webinar. We welcome you all today for this session. It is a great honor for me to moderate this session today. Our objective of the webinar today is to present the key priorities of Bangladesh's newly endorsed National Oral Health Strategy and also how we are going to implement it. And we have our expert panelists here and speakers from home and abroad who will help us to discuss about the situation and the strong points and how to implement the strategy. Welcome again. Good afternoon, distinguished guests, respected speakers, colleagues, and student participants. I warmly welcome you to this Oral Health Series webinar titled From Strategy to Action, Implementing Bangladesh's National Oral Strategy. Thank you to all. We'd also like to thank World Federation of Public Health Associations for supporting us in this session. With a very sad mood, I would like to explain an unfortunate situation. The Middle East crisis has affected our webinar also. Our international speaker, Professor Raman Bedi, he had to fly to China today. Because of this Middle East crisis, he had several uncertainty in his flight schedule and itinerary. And unfortunately, yesterday he explained it to us that now that we are talking in our webinar, he is flying to China. But we are thankful that Professor Bedi also gave us some time yesterday. It was a very, I would say, sudden situation and an emergency, urgent situation. So we took his interview and also his presentation in a recording. He gave us enough time to discuss about it and present it. So we'll be sharing the video with you. And if time permits, we will share the question answer session also. Thank you so much. So now I would like to, before beginning, I would like to introduce our chair, Professor Sharmin Yasmin. Professor Sharmin Yasmin is the chairperson of Public Health Foundation Bangladesh and the inspiration for our public health work. And also we are starting oral health series under his leadership. Thank you, ma'am, for joining us in this session as our chair. I would like to start with our first speaker. After that, we will go for Professor Raman Bedi's presentation, and then we will go for our panelist discussion. So first, I would like to introduce our first presenter, Dr. Professor A.F.M. Sarwar sir. He is the former vice principal of Dhaka Dental College and a key expert involved in the development of the National Oral Health Strategy. Sir, the floor is yours. Please proceed.
Thanks a lot, Shigutta.
Sir, you are muted.
No. Hopefully, I am not muted. Is my audible to everybody?
Yeah, we can hear you.
I would like to, Yakub, our...
Okay. Thank you very much. Sir. I am Professor Dr. A.F.M. Sarwar as the Vice Principal of Dhaka Dental College. Now, existing, I am working at Bangladesh University of Health Sciences, that is BUHS, in the Department of Occupational and Environmental Health. Including this, I am attached to Center for Law and Policy Affairs as a research consultant, along with other some NGOs like UNICEF, international NGOs, WHO, UNICEF, GAIN, JANIDA, NATAB, and air condition. And this scenario is to be created or presented by me by the help of WHO and Earth Foundation to demonstrate this strategy action plan by a series of activities, one-to-one meeting, group discussion, etc., etc. Now, I am just straight to go my presentation. You can see it.
Yes, sir, it is visible.
Sir, do you want us to share the slides?
You share it from your side.
Sir, do you want us to share the slides from our end?
Yeah.
Okay. I would request Yakub, please share the slides.
Thank you. Could you please share the screen on your side, please?
Share it, but not shown. Why?
It's visible now.
Yes, it is visible.
Okay,
Well and
thank
good.
you. Can I move the next slide? Because already the intro is done from.
Yes.
Okay. Next slide. First of all, in introduction session, just I am telling you about the national health strategy, which is what is it and why it is to be done. Because our oral health strategy action plan 25-2030 of Bangladesh addresses the high burden of oral disease, affecting over 80% of our population. And it is now aligned with WHO and SDG Goal 3, that is the ensure the healthy lives and promote well-being for all at all ages. That means it focuses on prevention, equity, workforce strengthening, and primary healthcare integration to build a sustainable, strengthened, and accessible oral health system. But in this country, there is no accessible oral health field. Even we have a health policy 2011, but there is not a single word introduced there as oral or dental. So now it is supported by oral health because oral disease is the part of, everybody knows that it is a part of a non-communicable diseases and affect overall health quality because oral health is the gateway to the general health. So it depends on overall health, quality of life and productivity. Improving oral health care to the universal health coverage, that means equity, and reduce the incentive burden to our country as well as the abroad. So, next slide. If we studied it, we can see that over 80% of population is affected by oral disease, undoubtedly. And in our least development country like Bangladesh, have 71% never received the dental care. And we have also the very, very limited rural access and urban centered workforce. That means we have the resource person as the workforce is limited. And in this cause, this rising incidence, as a result, the rising incidence of oral cancer, which is already mentioned, 14,000 new cases reported, though it is 2020, but update data is not available because we have also in the data scarcity. Next. Next. So, in public health context, if we look after this, that means rising oral disease and oral cancer. Including why this is in our country, high tobacco use is one of the major risk factors for oral disease as well as oral cancer. Systemic gaps in service delivery because we have no source of money as well as no active participant or no expert like oral health expert in rural or rural and urban areas. So there is a systemic gap in service delivery. Next. And in the global and regional alignment, if we see the WHO had the umbrella handle of these diseases, WHO, and by the help of them, universal health coverage is another section. Then we want to sustainable developmental goal to reach, as well as we studied about evidence-based participatory approach. If we don't participate, we can do nothing. What are the objectives? Each and every work has some objective and special objectives. Like in this study, to identify key priorities, to discuss about the role of dental professional, to engage academic, global and youth perspective, to identify the methods for the next step within 2 to 3 years. Because after the session, how we will implement this, by the next 2 to 3 years, we can do it. And to focus on translating the strategy into action. That means we go through for this strategic action plan towards our people, and we establish it and implement it. How we can establish it? Obviously, we need some leadership. Who will be the leader? That is led by Ministry of Health and Family Welfare, DGHS, and certain professionals like dental surgeon, maybe any medical professional, NGOs, and civil societies of organization like government department of public health institution, dental college, professional associations, development partners like NGOs, and technical support. Without technical support in our country like Bangladesh, never to achieve any activities or any action plan. So we have need some support from, that is WHO, provided expert input as well as conducted workshop, training and session by them with other NGOs. This is done by the specially collaboration with the Art Foundation. Next. What should be the method? It is the systemic, participatory and evidence-based approach to ensure relevance, visibility and alignment with the global standard. As because my introduction, my self-credentiality, I also told that how can we achieve this by some FZDs, some training, meeting, etc., etc. So next. What would be the strategic objective? That was our action plan objective. This is the strategic objective in which way we can go through. That is the governance and leadership, access and equity of care, workforce development, promotion and prevention, data and research, and finally money. That is financing. Next. What should be the target? 2030. By 2030, we achieve more than 80% population under coverage of this oral health service. integrate the oral health into primary healthcare, as well as increase the utilization of oral health service, especially in the rural as well as urban area. As a result, we can achieve at least 25% reduction of the untreated dental caries, along with 33.3% reduction in oral cancer mortality, ultimately improved oral health outcome nationwide. What should be the intervention? Integrate of oral health into primary healthcare. It is one of the intervention that strengthen the community clinic and opposite health complexes. This UHCS is not universal health coverage. This stands for opposite health complexes. Then ensure essential medicines and equipment. In our country, at the rural area, no medicine, proper medicine will be supplied. So it is obviously we have to ensure about the medicine and equipment. Then promote oral hygiene and tobacco control, workforce training and capacity building, as well as some advocacy. Next, that is what is the focus on vulnerable group, mainly children and elderly. Our life is start from child and end in the adult. But child scenario and adult scenario almost oral cavity like same. So in children is a very careful situation, along with the elderly is a careful situation, including rural and underserved population. In rural and underserved population, targeted outreach and preventive care. Next. What are the risk factors and economic impact? High tobacco use, then poor oral hygiene, inadequate product exposure, high productivity loss, low national investment in oral health. Really, it is very unfortunate for oral health strategic action or any oral health condition, the low national investment in oral health and limited awareness in rural community. It is our literacy rate. There are so many factors are responsible for this. What is the risk factor? High tobacco is okay. Next. What should be the in concluding of this scenario is the timely and essential national initiative, focus on equity, prevention, access, supports universal health coverage and SDG goals, improves health and national development. Next, some remarks. Strategic and sustained investment in oral health is therefore not only a public health concern, but also a cost-effective development intervention aligned with national priorities in universal health communities. Then need for urgent coordination in the national action. So it will be the strategic milestone for Bangladesh if we implement for the next. So I think thank you very much for patient sharing.
Thank you so much, sir, for a nice presentation, a bright and interesting presentation, and with a lot of insights on how to proceed further. And we appreciate you going through all the way to this process and creating this new opportunity for us to work on the progress of oral health. Thank you so much. Now I would like to go to the next presentation of Professor Raman Bedi. Professor Raman Bedi apologized to us and to the session participants for his absence today. Let us proceed to the presentation.
Sir, Sarwar sir, may I request to you, please stop your screen share from your end.
Okay.
It's visible now.
Yes, it is visible.
Thank you so much. And thank you for inviting me to participate in your conference. And I do apologize that, but I do have to be in China tomorrow, so I will not be actually able. But I'm pleased we can do this recording. My name is Professor Raman Bedi. I'm an emeritus professor at King's College London, and I'm will in May become the president of the World Federation of Public Health Associations. I think I'll be the first dentist ever to hold that position, so it's good news for dentistry. And I was formerly a chief dental officer for England. I've reviewed your oral health strategy, and I have just a few comments to make to start off your discussions and your Congress. There's a scale of the problem that we're all facing, and Bangladesh is no different to many other countries. 80% of the population is affected by oral disease, and of course, oral cancer is particularly significant in the subcontinent, at 14,000 new oral cancer cases present each year. But the challenge you have is also 71% of the people surveyed had never received dental care. Your population of dentists to the public is low at 0.6%. So you have a challenge as you have one of the lowest dentist to population ratios in the region. So really workforce expansion is not optional, it's essential. And so this strategy endorses that, and it's a genuine turning point, and Bangladesh itself needs and deserves a recognition for that leadership. Next slide, please. So what have you done right with regard to this strategy? Well, first of all, it aligns with the WHO. WHO has made it very clear in its strategy, and certainly for the region, that you need to establish clear, measurable goals by 2030, and that's only 4 years away. The policy is correct in that you're looking at upstream policies. In other words, the sugar and the political will needed to bring about the sugar tax and curbing other things, maybe in schools, etc. The strategy is right because one of the most important things that we face in global public health is the non-communicable disease crisis. And oral health fits very much within that. So we need to say to our colleagues that are dealing with diabetes, coronary heart disease, and other NCDs, oral health is not an option, it's essential. There is no health without oral health. The World Federation of Public Health Associations presidency, my presidency, oral health will be an important priority. In fact, it will be the priority. We will begin to ask our member states, over 140 of them throughout the world, to be integrating oral health into the global NCD framework. It's a central legal legacy commitment, and I'm really pleased that Bangladesh is taking this lead. Next slide, please. But making it work. So having reviewed your strategy, I think there's 7 recommendations. The first is the importance of integrating into primary care. In other words, train your community health workers as oral health first responders. Don't wait for standalone dental care professionals to enter the system. You have community health workers, begin to train them. But oral cancer is a political lever. You can use that. You have a high number of cases, 14,000 new cases per year. It's visible, it's measurable, and you could achieve the 33% mortality reduction with early detection. So you don't need dentists to do early detection alone. You can train your community health workers to look at early detection. Expand your workforce. Think about other players other than just dentists, dental therapists, nurses, community health workers. To be legally recognized. Look at other countries like the United Kingdom or Thailand or Sri Lanka. Fix your data systems. No data on dental assistants for 2014 to 19. Look at the collection of data that you're collecting and make sure that you fully understand where you are today, and then you can actually have the targets for 2030 measured. Next slide, please. I think it's very important in countries like Bangladesh is to mobilize faith communities as well. Faith communities are one of the largest civil society communities, and too often in public health we haven't used them. They may seem distant to some, but actually they have great impact. Ask the faith communities to help about oral health advice, to encourage people to visit their dentists, and also to become advocates, especially in rural settings. One of the difficulties oral health has all throughout the world is actually fixing its budgets. We don't spend enough on oral health. And so you should make sure you dedicate an oral health budget within the overall health budget. However modest, it signals the commitment to enable accountability and it avoids donor dependency. One of the targets for 2030 is to ensure that there is a definite oral health budget line within the national budget. Then, of course, fourthly, is to join a learning network. There are many countries surrounding you that actually you could actually use to encourage the learning network. Learn from peers. Come to congresses like the World Congress of Public Health in Cape Town in September 2026. But there'll be other congresses as well. Encourage that learning. And now with IT and instant access through IT systems, we can actually do peer support. We can actually learn from each other and we can communicate. The equity imperative. Children, older people, rural communities, informal urban settings, and people living in poverty, people with disabilities. Global public health has always had an equity lens. We see what we do, we see our population we want to serve, we see our activities through an equity lens. In other words, everyone deserves to receive oral health care. And these are the most vulnerable people who we should ensure to receive that. So through the equity imperative, your plan has to be at the center an equity focus, not an afterthought. It's got to be right at the heart of everything that you do. Next slide, please. The strategy is strong, and I encourage everyone and compliment everyone who's put this together. Not many countries do have a national oral health strategy, but you've actually put one together. But the hard work starts now in implementing it. So the things I would say is implement the strategy at its very heart with equity. Expand who counts as oral health workers. Don't try and limit dentistry just to dentists and prevent other people from contributing. Embrace community health workers. You need to measure relentlessly and publish so the world can learn from you. You've made a great start in this oral health strategy. You should begin to tell the world about it. Engage civil society, particularly faith communities, and they can help you reach where clinics cannot. And then connect with global networks, particularly in the subcontinent and the Asia Pacific. Begin to discuss with like-minded people the lessons you're learning and the lessons that you can learn from them. Next slide, please.
That was Professor Raman Bedi from UK, and he apologized to us because he couldn't join us today. Well, our heartiest thanks to Professor Raman Bedi for giving us the time and allotting us the time at the last moment also. And we will have him again together with us again, inshallah. Now we will proceed to the panel discussion. Our expert panelists are here. Professor Parimal Chandra Mallik, Professor Dr. A.F.M. Shahidur Rahman, Dr. Muhammad Asafuzzoha Raz, Dr. Khurshid Alam Haidar, Dr. Silva Lina, and lastly, Radrik Hassan, who is our student representative. Welcome to the webinar.
Sorry, Dr. Shagupta, Thank you very much for inviting me in your nice and valuable webinar in the topics of Bangladesh National Oral Health Strategy and its action plan. But I
Thank you,
cannot
sir.
hear you
Sir,
clearly.
oh, you cannot hear me clearly.
I cannot hear you. Can you hear?
Can you hear me now, sir?
Still now
Yes,
I cannot hear you.
yes, we can. Yeah.
Okay. Now
You
let
can,
me
you can hear.
introduce.
We can hear.
Okay. Okay. Now I would like to introduce Professor Mollik. He is an academician with more than 25
Anyway,
years of teaching. Sir, can you hear me? I am trying to introduce you, sir. Uh,
Mollik,
can
you
you
are
hear
unmuted.
me? Sir,
Please unmute. Unmute.
okay. Sir, can you hear me? Okay, we will proceed. Shajib, can you unmute, sir?
Ma'am, I can't unmute him if he didn't. Do not.
Now it is done.
Now,
Now
now,
it
can
is
you
done.
hear me?
now it is. Yes,
Yes,
we can
yes.
hear you. We can
Okay,
hear
thank
you,
you.
sir.
I would like to give the
Sir,
thanks to Professor Dr. Afoma Sarwar, who was the key presenter of this webinar, and the honorable panelists, Professor Dr. Saidur Rahman Lemon, Dr. Asaf Ujjaraj, Dr. M.D. Khurshid Alam Haidar, Dr. Silwa Lina, and Rad Riq Hassan, and the nice present moderator, Dr. Sagupta Mahmood. Everybody, welcome you and very thanks from Bangladesh Dental Society and from the community of dental surgeons of Bangladesh. You might know that from our initiative of Bangladesh Dental Society and other faculties like Professor Dr. Apomo Sarwar and along with other dental surgeons, Bangladesh government has endorsed a new national strategy of dental oral health and its action plan 2025 to 2030. Now the point is that how we'll implement this action oral strategy plan of Bangladesh. You might know, you also heard that Professor Dr. Sarwar said that in 2011, Bangladesh government has endorsed a health plan. And in that health plan, there was not a single line about oral health studies. And there was not any allocation of funds or money to improvement the oral health sites in the field of Bangladesh. But it's a happy news for us, for the dental surgeons, for the people of Bangladesh, that from this year, Bangladesh government has lastly endorsed the oral health strategy and its action plan. Now, the point is important. How we would implement this strategy in the field of Bangladesh to improve the oral health of the people of Bangladesh. I would like to say that first of all, the role of Bangladesh Dental Society is very important to implement the strategy within the pupils of Bangladesh. And I think, and I would like to express my gratitude to you all that the authority or executive committee of Bangladesh Dental Society is ready to take action plan to implement this strategy in all over the Bangladesh to get at the positive result of the health policy of Bangladesh government in the leadership of our Honorable Prime Minister, Janab Tariq Rahman. And to make it positive in Bangladesh health sectors, first of all, we should change our curriculum in undergraduate level, because you should know, or you might know, that in our 5 years course, that dental public health is not a single or individual subject yet now. But in whole over the world, the public health subject is individuals in BDS course curriculum or DDS course curriculum in European or American countries. So this government, or in the period of interim government, we have already worked to change our BDS course curriculum in making an individual subject in dental public health, which will be included in third phase of our 5 years course, BDS course. And it is in the stage of final and waiting in the Bangladesh Medical and Dental Council to recognize finally. I hope with the help of the faculties, doctors, and students of Bangladesh in dentistry fields, this course curriculum will be finally published or endorsed in the educational sectors of dental institutions. Second point is that students of our dental institutions should be trained enough how they will implement their knowledge in the prevention sectors of our pupils. That's why the 80% pupils are in risks of dental problems or oral problems will be decreased in times. I think in the course curriculum or the educational period, they will be learned enough if they can gain individual subjects in dental public health. Fourth point is that our doctors who have already passed and working in several sectors and fields of Bangladesh in dental treatment sites, they should be trained enough how they can make the people to alert about oral health and prevention sites. And we should mobilize our peoples, general peoples, local peoples, and urban peoples also. Main point is the involvement of our government, like Ministry of Health and Family Welfare, DG Health, and social welfare organizations like NGOs, and mainly is WHO. And international organizations, several like World Public Health Foundation or organizations, and we should mobilize them to work together with Bangladesh Dental Society and Bangladesh Public Health Foundations also to improve or implement the oral health strategy and its action plan in Bangladesh. Lastly, the main point is that it needs the funds or money to make it positive or implement the strategy in the peoples. I think WHO have helped us in preparing the National Oral Health Strategy and its action plan in collaboration with the ARC Foundation, and our faculties have worked hard to make it positive. So in near future, I would request the organizers of WHO and several international organizations in abroad should come forward to help us in making it positive and successful to integrate the National Oral Health Strategy and its action plan and save our people and save our nations by reducing the dental problem and make success of the health plan and policy of our government by the leadership of our Prime Minister Mr. Tariq Rahman, and we'll work together with the Health Ministry as well as Government of Bangladesh and international organizations like WHO and World Public Health Foundations and Bangladesh Public Health Foundation. We're looking forward to work together. And thank you very much, and stay fine. And thanks again to invite me here. Thank you very much.
Thank you, sir.
And lastly, I
Professor
would like to
Monlik, sir.
thank Dr. Shagupta Mahmood, who has invited me and has inspired me to be present here. And lastly, I would like to say, and she was my first student in my teacher's life. Okay? Thank
Yes,
you,
sir.
and stay fine,
Thank you. Thank
and
you,
be
sir.
happy in future life. Okay, you continue, please.
Thank you, sir. Thank you, sir.
Sir.
Professor Porimal Chandra
Please.
Mollik, sir, for
Doctor,
such an knowledgeable discussion and giving us some ideas on how to proceed and to whom we should approach. Thank you, sir.
Doctor.
And also,
please, I mean, just a single word. I am
Yes,
just seeing Professor Mujibur Rahman Hawladar, Provisy of Bangladesh University is here. Provisy, Professor Dr. Mujibur Rahman Hawladar.
welcome, Professor Mujibur Rahman Hawladar, sir. I'm honored to have you here. And you are also one
Thank
of
you.
my direct teachers. I'm so honored to have two of my teachers here. We will come to you, sir, for a question. Of course, we'll need your insight. Please stay with us. Thank you, sir. Thank you so
Thank you
much.
so much, and very good evening to everyone. Definitely, I will enjoy the whole session. I will continue at the end also. Okay.
Thank you, sir. Thank you, sir. On our next panelist list, we have Professor Dr. A.F.M. Shahidur Rahman. Professor Rahman serves as Director of Dental Education at the Directorate General of Medical Education in DGME, playing a key role in shaping national dental education policies and workforce development. Professor Rahman, I would like to pose a direct question to you now that we have short time. What policy level changes are needed to strengthen the oral health workforce? Please,
Thank you.
from
And
your
thank you.
DGME background.
Thank you. And thank you all. And good evening. I would like to give thanks to Professor Dr. Sarwar sir and Professor Dr. Raman Bedi. And also, I would like to give thanks and elaborate explanation about our Bangladesh from Professor Dr. Porimal Chandra Mollik, President, Bangladesh Dental Society. In short, I'd like to say Health Ministry and as well as DGHS and DGME can strengthen the oral health workforce by developing proper policies, improving education and training, ensuring recruitment and equal distribution to overall the country, like urban area and rural area, as well as divisional areas and as well as districts and upazalas level, and strengthening the infrastructure and promoting prevention programs and supporting continuous monitoring and research, and to integrate the oral health into the primary health care system so that we can reduce the dental caries prevalence rate as well as the oral cancer rate by early detection of oral cancer and screening program. So, and also we should improve our access or our people's access to oral health services. And so in our DGME, Director General of Medical Education, it's a two-part Director General of Health Services, and we are dealing the Director General of Medical Education, that means the education system. So we can improve our education system, dental education system, by improving the curriculum, and hopeful that last year we have submitted the new curriculum for BDS to the BMDC with the help of WHO, and this part has implemented by Center for Medical Education, CME, with the collaboration of our help and suggestions of our dental medical teachers and Bangladesh Dental Society. It is reviewing by BMDC. They are reviewing their curriculum to standardize the hour and tutorial classes system. So hopefully we can implement this new curriculum in 2017. We are hopeful for that. So, National Oral Health Policy, Planning, Education and Training. Now we are giving training to our teachers and to implement the integrated teaching learning system and modular based, evidence based learning. So, by this way, we can teach our teachers as well as students. And DGHS Health Services also trained our dental surgeons, freshly graduated graduate dental surgeons, and so that we can improve ourselves and so we can provide better services to our people. Thank you.
Thank you so much, Professor Rahman. It was very important things that you mentioned about the insights from the DGME. We would proceed our discussion even after the webinar, how Public Health Foundation can support DGME and do researches together to improve our medical education even more. Thank you so much. Now I would like to go to our next panelist, Dr. Muhammad Asafuzzohar Raj. Dr. Raj is the General Secretary of the Bangladesh Federation of Dental Sciences, representing civil society and working to strengthen professional engagement and advocacy in oral health. Also, Professor Dr. Muhammad Asafuzzohar Raj has a long experience of private practice, so we would like to hear more about the background from private practitioners. So I would like to pose a direct question to Dr. Asafuzzohar Raj. How can civil society strengthen awareness and accountability, the private practitioners and people like you? Thank you so much.
Thank you so much, Dr. Sheikh Muhammad. Assalamu alaikum and very good evening to all. I am seeing my direct teacher, Professor Dr. Mujibur Rahman Havladar sir, Dr. Parimal Chandra Murli sir, one of my best well-wishers, Sarwar and Livan Bhai, all of us. Grateful to all. So I am very much delighted to present in this excellent discussion group. Civil society can play a crucial role in both awareness and accountability. First of all, they can lead community-based awareness campaigns using school, electronic and printing media, and local organizations to promote the prevention of our oral health, especially in rural area, by using dental education program or by arranging a health awareness rally or arranging a group discussion in a big mosque where many people came together to play an important role about the social community. Secondly, civil society can act as a bridge to fulfill the gap in between the health policy maker and the other dental active organization, including Bangladesh Dental Society and the community. And lastly, the terms of accountability, they can monitor the implementation of policy and advocate the transparency. I think that the way for civil society to be a part of this health strategy for more implication. Thank you.
Thank you so much, Dr. Raj. We can see that you have positive attitude to work with the Dental Society and other organizations, and we would be hoping to work with the Bangladesh Federation of Dental Sciences in our next community level work. Thank you so much.
Inshallah. Thank you.
Inshallah. Now I would like to go to our next panelist, Dr. Khurshid Alam Haidar. Dr. Muhammad Khurshid Alam Haidar is a distinguished global public health expert with extensive experience in tuberculosis control and health system strengthening. He has served in senior roles with the World Health Organization, including regional advisor for tuberculosis at the Southeast Asia Regional Office, and team lead of health system strengthening, which we want more, health system strengthening in Nepal. He also contributed to Bangladesh National Health Programs through his work with the Directorate General of Health Services. So to you, Dr. Khurshid, please say a few words. I could go to direct questions to you, like how does this strategy align with the broader health system and the UHC goals? Please answer from the background of your WHO background perspective. Thank you.
Thank you very much. Thank you very much. Respected chair, moderator, distinguished speakers, and panelists, good morning and good evening. It's my pleasure to join with you in this discussion in advancing Bangladesh National Oral Health Strategy. We know that oral health is no longer a standalone issue. We are talking about one of the most widespread non-communicable diseases, a condition that shares same risk factors, the same social determinants, and same inequities that drive the broader NCD epidemic in Bangladesh. The Bangladesh National Oral Health Strategy 2025-2030 is explicitly designed to advance broader health systems goal and UHC in different or several key ways. The first, it integrates oral health into primary health care, and which is the cornerstone of universal health coverage by embedding prevention, early detection, and basic treatment within the frontline services. This directly expands service coverage, ensuring essential oral health services are available where people are in need. Second, the strategy prioritizes equitable access, particularly for rural and vulnerable populations, addressing long-standing disparities. By doing so, it contributes population coverage, a core UHC dimension, and aligns with Bangladesh's broader goal of reaching underserved population. Third, it emphasizes on sustainable financing and costed action plan to support financial protection, aiming to reduce out-of-pocket expenditure, which is one of the major barriers of Bangladesh health systems care. Fourth, the strategy strengthens health system building blocks, including the workforce development, governance, data system, and multi-sectoral actions, which are essential for resilient and efficient UHC-oriented systems. Finally, by aligning with WHO Global Oral Health Strategy and SDG 3, it ensures that oral health is no longer siloed, but becomes an integral part of UHC benefit package and NCD agenda. So in terms of partnership, Bangladesh World Health Organization country office is leading the UN agencies UNFPA, UNICEF, UNAIDS to align the priorities of the government, which includes universal health coverage, then climate and health, addressing the underserved population, which will help to align the strategies of oral health. So, in summary, I would advocate from WHO or provide technical support to the Ministry of Health and other UN agencies, including other international and national NGOs, to operationalize this strategy, making oral health accessible, equitable, integrated, and financially sustainable, while simultaneously strengthening the overall health systems. Thank you very much for giving me the opportunity. Thank you once again, the moderator, and thank you for inviting me, Shagufta. Thank you.
Thank you so much, Dr. Khurshid. It was very helpful for all of us to know the avenues from your end. We will proceed our discussion further from there on. At this moment, we have our next panelist, Dr. Silva Lina. She is a research associate at ARC Foundation, actively engaged in public health research and evidence generation to support policy and program development. I would request Dr. Silva Lina to answer a direct question. As we don't have time, I would allocate 2 minutes only for you. Dr. Silva Lina, what role does the research and data play in successful implementation of this strategy? Please, Dr. Silva Lina. Dr. Silva Lina, can you hear us? Okay, we cannot hear her. Then I would go forward to Radric Hassan. Radric Hassan is the Secretary General of the International Association of Dental Students in Bangladesh, representing youth voices and promoting student engagement in oral health initiatives. I would request Radric, as I mentioned, in a short time, 2 minutes, and I would like to ask you a direct question. How can youth and students contribute meaningfully to this implementation of this oral health strategy? Please, Radric.
Thank you so much, ma'am, for the question. And I would like to give my gratitude to all because to be with one of so many respected guests is an honor for me. So if I talk about the youth or dental students perspective, as I've been working in the International Dental Student Association in Bangladesh and in many youth organizations, we can have some strategic plans to engage or mobilize dental students in Bangladesh. For instance, if I come to the National Oral Health Strategic Plan, specifically Objective 2, in 2.6, it has been mentioned to capacitate the dental practitioners or the dental auxiliaries. But if we can capacitate dental students, for instance, if we can organize oral health youth leadership training, where the dental students will not only be taught about the oral counseling processes, but rather they would be taught how to initiate community collective action plans or projects in their own community, so that they can learn this and go to their community and provide a collective action project. By this, it creates a ripple effect, because when dental students is representing their community or going to their community, that community has a immense trust in them, because they are becoming the future medical, the future doctors. So this will create a very organic, I think, prevention methodology for dental students. Secondly, I would like to address, in case of Objective 3, specifically 3.2.2, where we can, the students organizations can work with the Ministry of Health and Family Welfare for mass awareness, utilizing the social media, as the youth are very equipped and very knowledgeable about it. For instance, we can partner up with the local influencers, the social media influencers, in spreading various messages to the mass community, because currently the rate of online engagement is increasing day by day. And lastly, I would say that for making a change, every voice needs to be heard. So I would request, if it's possible, to include the student representative or include the student voice in the technical advisory committee in the strategic oral health plan, because I believe youth and the students bring some fresh ideas onto the table, which we can implement, or we can catalyze the implement further. I would like to add another thing after hearing from the DDPE and DGME sirs. So what we can do, this is a completely new idea which I thought of now. So we have our dental public health subject where we do thesis, and every dental colleges do thesis from this. So if we could ensure a topic, or for example, oral hygiene status. This session will focus on oral hygiene status, and the whole country's dental policies focus on that. So we can identify the prevalence or the nature of disease of oral hygiene status for the whole country for that specific session. In the next session, we can focus on like gingival index. The next session, we can focus on periodontal. I think in this way, we can involve the students and the dental colleges to provide a very organic research plan, which they can report back to the Ministry of Health and Family Welfare. Sorry, I think I prolonged my time a bit, and I'm really honored that I could share my insights and voices. And please do forgive any mistakes from my part. Thank you so much.
Thank you so much, Radrik. It is true that the youth provide us with some fresh ideas, and you have given us some new ideas to think about. And also, I have seen in the strategy there were priority ideas about a national oral health survey every 5 years. We do need the National Oral Health Survey, and I could see that our youth population and young students, they can play a big role. They have the energy, they have the enthusiasm. Thank you so much, Rad, and we'll be counting on your organization also. At this moment, I would like to make a little change in the webinar. As we have Professor Dr. Muhammad Mujibur Rahman Hawladar Sir among with us, I would like to hear a few words from Sir about our discussion and giving us some insights for proceeding the implementation of this oral health strategy. Sir, I'm very sorry that we have a very short time limit. So if you could say something briefly, that would be very fine. Thank you, sir. Mujibur Rahman, sir.
Thank you so much for giving me the privilege to say a few words in your webinar. I was not previously prepared for the session. Suddenly, I got your message that this is today is a seminar. That's the webinar will have to be happen, and that's why I have become interested to participate, because before doing statistical planning of the government of oral health strategy of Bangladesh, I was somehow involved with the process, and I had attended in several meetings in the action of the activities of strategic planning. First of all, I would like to share some insights regarding the discussion overall that you have already seen and you have listened. The expert opinion has given by sub-learned audience from our part and from the international forum also. And from my part, regarding the NCDs, because I'm working in the medical university, and that is why I had to play some responsibility in nationwide activities. Most recently, the government had planned to do some activities. So one of them is in North Bengal, 1,000 bed hospital that is general and special. And that in that part, what was the activities of our part, that is oral health. They fortunately, or anyway, one of the 7-member committee from the office of our Honorable Prime Minister, a committee of the experts led by the health secretary, and one of the member of the expert subject, I was included in there, and I had played my role there regarding oral health problems of that North Bengal side of the community. So regarding NCDs in Bangladesh, all of you know, there are lots of diseases are focused in the community, but oral health is mostly neglected. Mostly neglected in that sense. Till now, we don't have any strategic plan. Anyway, the strategic plan has been already endorsed by the government, all of you know. So, I was just talking about the matter, the busy health of the government last week in a meeting, or what to implement this program in Bangladesh. From my point, we'll have to consider the community-based activities that may be dental caries, and one of the speaker has given the idea about the screening program for the prevention. I think that if you think about the screening program, then regarding dental caries, you can consider that one. And if you think about the prevention, you can also, can you think about the vaccination against the streptomutans for dental caries? And another important point, that prevention of oral cancer, that also can also be considered as a vaccination program. We have a research program in our university under Health Ministry, that human papilloma virus is one of the factors for developing oral carcinoma. And also there are some projects in carcinoma in cervix. So we have a joint program in the university. You can think about the prevention of oral cancer for vaccination of HPV, human papilloma virus also. And third one, I would like to share that don't neglect the periodontal health, because most of the prevalent disease among all human disease, even not in Bangladesh, also in the globally, is a periodontal disease. And you have started in your program, I have heard oral health is considered as a gateway of our general health. If it is like that, you should consider the status of oral health for the preservation or for the improvement of our general health. That is why periodontal health should be considered. What is the consideration? Because there are lots of connectivity with periodontal health, like some other systemic disease like CVD, maybe some other cardiac or renal or systemic, many other involvement. So, in third one, I want to share that the research program should be planning in and the execution of the research project. There should have some sort of idea and your suggestion. And in case of community, you should think about the primary school health education. And so far I can remember, I had the opportunity to work in community school, in primary school healthcare. In our country, Van Palenston Helderman was the WHO consultant, and there was a program throughout the whole country. You can think about the strategic plan regarding the oral health education, by WHO and some other international organizations like World Bank or UNICEF, or you can think locally in the Ministry of Science and Technology, because they are also involved with the many research projects. So in case of oral health, school oral health care, also maybe there is a brushing session in the school routine also. These are the primary focus. And finally, collaborative approach with the global and national forums. That is very much important. If you want to go forward, that the world is moving forward, not alone. We'll have to connect it with each another. We'll have to move with the foreign collaborators. This is my comments, and thank you so much for giving me the privilege to share this words.
Thank you, sir. Thank you so much. It is an honor to have you all here. And I can see you have the positive side from your discussion. I can see that we can work together, like Public Health Foundation can work together with BMU and also with Bangladesh Dental Society, and then we can make important changes. And also, of course, Dr. Asafuzzohar Raj also will be working with us, inshallah. We are just about in time, but still we have some time, and I would like to request our chairperson, Professor Sharmin Yasmin, who is the head of the Department of Community Medicine in Bangladesh Medical College, and she is a renowned public health leader and leading the Public Health Foundation Bangladesh very successfully, and I would say very, very, very successfully. Thank you, madam, for joining us. You have been through with us the whole session. I would like to allocate 5 to 7 minutes to you. Please share us your insights and also the closing remarks and vote of thanks to Professor Sharmin Yasmin.
Thank you, Dr. Shegufta Mohammed, for your nice introduction. I was listening and I was overwhelmed to hear all the actually deliberations, two presentations from keynote speaker and honorable international speaker, and also from our panelists. These were very wonderful remarks and very constructive. So as a public health professional, I would say that I am with you, and I am very much happy to hear that the government has endorsed the national oral health care strategy from 2025 to 2030. Better late than before. Better late than never. Okay.
Never.
So there is a proverb that actually we neglect our teeth or our dental health care till they are gone. Right, so মানে বাংলায় যেটাকে বলে দাঁত থাকতে দাঁতের মর্যাদা আমরা বুঝি না আসলে. That is very true, and that is very much evident in our society and community. And in our keynote presentation, Professor Sarwar has very nicely presented all the aspects of the strategy and all the guidelines and what are the future plans. But main challenge is the implementation, and that is the objective of today's session, to exchange your views and ideas and recommendations. So, and again, Dr. Raman Bedi, Professor Raman Bedi, he also has highlighted the different challenges and gaps in the healthcare delivery system of oral health care, and it is existing in our health system since long. Actually, it is not a new, so it's a very old problem in our country, in our country context. So regarding the curriculum, what Professor Malik has said, that I very much agreed with him that dental public health should be considered as a basic subject in the dental curriculum of BDS. I'm very much connected with Bangladesh Dental College. As you know, that Bangladesh Medical College and Bangladesh Dental College, they are running parallelly under the same management. So I have very good communications with all the faculty there. And I know that there is a dental public health department in our college too. But what I think that everybody has mentioned in their speech, that preventive aspect is very much neglected. It is also in our side, in our medical side also. This is very much neglected, and dental side, it is really very much neglected. So we have to actually work on that, because already Professor Hauladar mentioned that we should have a school health program. That is very important, because early this is the catchment area actually. That I saw in the intern literature that there are 1100 dental professionals in our country, and number of the dental technologists are less than that. Like in our medical side also, doctors are more than the nurse, and technologists are less than the nurses. So we have to actually we have to produce skilled health workforce for the oral health care. We have to produce skilled doctor professionals, and also our supportive assisted health technologist, dental technologist. Because, and also you have mentioned very nicely that equity should be mentioned. So we see that there is disparity in the distribution of the health workforces in urban and rural area. And also we see that there are two vulnerable age group actually, the children and the elderly population. The dental problems are more among them. The elderly population, they suffer a lot from the dental problems. I think they should be given due care. And our society representatives like Professor Mollik Sir and also Dr. Raj, you mentioned that you have your own programs in your society. And Public Health Foundation, I would like to share with you happily that since the very beginning, we are giving a priority importance to oral health care, and we have organized oral health or dental checkup in different schools in our rural areas. So it was organized by Public Health Foundation, and also I am also a chairperson of Autism Welfare Foundation. One thing I should mention here that every year we organize a screening program in the Autism Awareness Day in our school, and very renowned dental surgeons, especially Professor Nasiruddin, every year come there and with his team and screen out the dental problems. And there is a problem we face that about the disabled child, of the neurodevelopmental people with special needs, where they would go. They have no place to go, and it is very difficult for them to avail the dental health cares. Even though they are affordable, they cannot make for their children so easy. So it is another thing I want to pay your due attention that. So you should, if you can make a facility in every area for those people with special needs for their dental checkup. They need scaling, but they don't. But every doctor is not actually know how to handle those students. So it is very important. And another thing, Professor Hauladar, you have mentioned that the research activities. This is very prime area for actually for sharing our knowledge, experience, and to move forward in this sector. And I would say that every year Public Health Foundation organize. Now we are organizing every 1 yearly, 2 yearly International Health Conference. And from the very beginning, and this year in December, we are organizing the 11th International Conference, Public Health Conference. And from the first conference, we actually arrange a separate session for the oral health and publication oral health presentation, oral paper presentation, and posters are always in our program. So, and it is very much important for the students, especially to know about the conference, and all our renowned speakers also who are here. You are invited to join our conference in December. So we are working on it now. And our DG from DGME, Professor Shahidur Rahman, he has said that from the policy they are working on skill workforce development and for uniform distribution of the resources, and also the recruitment facility. Recruitment facility is very important actually, and the posting. So if we want to ensure everyone the first contact, so where to contact? The first dental surgeon is posted in the Upazila Health Complex. What about the union? What about the community ward level and at the grassroots level? So I think for a oral health or dental health, there should also have a medical technologists or dental technologists below the Upazila level, so that they can they should be trained, of course, for the primary care. So I think that would have a wider coverage for our population. So in this aspect, actually there are more to say, and also about the tobacco and risk factors. You have said that tobacco and betel nut, and actually oral cancer was once a few years back, it was the topmost cause of cancer among the male and female population in Bangladesh, oral cancer. So it is a public health importance. If we consider, it has a huge impact and we have a great role to play. So we will work together, inshallah, in the coming days. And Shagufta, you please, I request Shagufta to lead the oral health team in the Public Health Foundation. And we are actually very much eager to contribute in the school health programs with the societies of oral health. So with that, I conclude my deliberation. I also like to thank all the invited guests here, the keynote speakers, and panelists, to give your valuable time with us. And we are looking forward to work more. Thank you so much.
Thank you so much, madam. It was a nice deliberation from you, and thank you all the participants, all the dignitaries, my teachers especially. I'm grateful to you, and also the participants from Public Health Foundation and all the dental surgeons all over Bangladesh. Thank you so much.
One thing I actually forgot to mention, that is, I think our
Yes.
Leading professionals are here. So in our NIPSAM, there is MPH in 8 disciplines, 8 or 9. So I think this is the high time to open a department of MPH in oral health. So since a long time, when I was a student of MPhil, I had a colleague there with me, Tamanna. She was from Bangladesh Dental College. She did also MPhil from there. So I think this is high time. There are also many dental surgeons who are doing MPH, but if MPH in oral health we can introduce, it will be more impactful in deliberation of the healthcare services in oral health. Thank you.
Thank you, madam. Unfortunately, we couldn't accommodate Dr. Silva Lina, but she shared her view about research and data in successful implementation of oral health strategy. But unfortunately, maybe we will discuss with her later. Thank you so much, our chair
For your
and everyone. Yes, sir.
Madam has raised a question regarding opening your course oral health, that is MPH.
Yes, sir.
We have started this course this year from coming session, oral health, that is MPH in oral health under Public Health Department and Public Health Faculty of Bangladesh Medical University. And that was
Thank you,
my
sir.
proposal. That was my proposal to introduce.
Simple comment.
Thank you, sir. Thank you, sir. Thank you, sir.
Sharmin,
Thank you so much.
Sharmin, madam.
But you can talk with the NIPSOM, other institutions, those who are dealing with the public health issues. That is why the oral health should not be neglected. So academic activities should also be included in their academic institutions.
Thank you so much, sir. And please, Professor Sarwar, if you have a comment.
Just a comment like that to Sharmin, madam. Existing, there are some universities having the dentistry, community dentistry is a subject. community dentistry is a subject is going on some universities as MPH level. What is the difference between the oral health and community dentistry? Please, madam, and
Thanks. Okay, did you ask me anything, Professor Sarwar?
yeah, I'm just asking you to like that community dentistry is the subject as the Bangladesh University of Health Sciences and as like state university, and we are trying. Hopefully, so far I know, NIPSOM has tried to open a field of community dentistry.
Okay, good.
And I
Thank you,
appreciate
sir.
your
Thank you, sir.
your oral health. Oral health, it should be just transferred to oral health. I mean, that is community dentistry to be supplemented by oral health, or
Thank
can I
you,
explain
sir. Thank you so much. I would thank everybody. Today we had a very engaging, interactive session. And now that we have gone from 1 hour to 1 hour and 30 minutes, so it shows that everybody was very enthusiastic and we delivered our best today. Thank you so much, everybody. With the permission
you.
of the chair, I would like to end the session today, but with the hope that we will have more conversation on this issue. Thank you so much.
Thank you.
Thank you.
Assalamu
Thank
alaikum.